everyone, and welcome to Boost Your Dentistry IQ. I'm Dr. Pam Maragliano-Muniz, Chief Editor of Dental Economics. So today I would like to talk about cementation of indirect restorations. There are so many things to consider when selecting a cement for crowns, inlays, onlays, etc. I know we have to consider the material that we are cementing, what the tooth looks like, whether we can isolate. There's so many things to consider. So with me today is Dr. Thomas Dudney. He is a graduate of the University of Alabama in Birmingham School of Dentistry. He is the former clinical director for the Aesthetic Advantage hands-on programs taught by Dr. Larry Rosenthal at New York University and the Eastman Dental Clinic in London. Presently, he is the clinical director of the Pacific Aesthetic Continuum, or PAC, hands-on programs. In addition to teaching hands-on programs, he has presented workshops and lectures at dental meetings and has authored several articles on aesthetic and restorative dentistry. Tom, thanks so much for joining me today.
Great to be with you, Pam.
So I know you saw patients today. I saw patients earlier today. What are the different factors you consider when you're going to cement an indirect restoration?
Well, I think, one of the big things is, and you're right, and one of the things that makes it, I'm going to start off by just saying, you're right. I did see patients today, and I actually did, cement some crowns, and actually we bonded a veneer on today. So I've actually done both today. And so we encounter these things on a day-to-day basis, indirect restorations. So I think the biggest factors is in choosing what cement we're going to use is the retentive properties of the tooth that we're bonding to, or the structure that we're bonding to. It's interesting, but I believe that if you have the right resistance and retention form, in other words, if your tooth, let's just take a molar, for example, because that's by far what most of our posterior dentistry, molar crowns, premolar crowns. But if you have 4 millimeters of axial wall height and you have 6 to 8 degrees of taper, almost any cement you use, if your preparation is retentive, you could probably use any kind of cement. I mean, they're all going to work. The problem with cementation comes in usually more in non-retentive preparations. But since we're doing a lot of these restorations, and even with simplicity, we're going to want something that works pretty well. It's easy to handle, that works well in our hands, that has maybe good longevity, that could actually benefit the patient from the standpoint of the lifetime of that restoration. So there are some newer cements today that, although even the old cements, the zinc phosphates and all the things that we learned in dental school, they would still work today with the retentive prep. There's some new properties of some of these cements that I'm sure we'll get into and we'll talk about that makes these newer cements even more attractive. But the one thing, if you ask me, that just what are we going to do would be, is a prep retentive or not?
I couldn't agree more. I'm listening to this and my heart is just singing hearing you say that. So let's focus a little bit on the recent innovations. I know that there's a new cement out from GC America, and I know it helps to streamline the cementation process. Can you describe that cement and how it works?
Yeah, well, their new product is called G-CEM ONE, and it's a self-adhesive resin cement. So, to understand self-adhesive resin cement, it's a resin cement. But the difference with self-adhesive resin cements is you don't have to treat the tooth in any way, and you don't have to treat the restoration in any special way. When we adhesively bond a tooth, in other words, let's say you had a porcelain veneer. I use that as an example because you're going to have a very non-retentive prep. In other words, the restoration isn't going to stay on by any natural retention. So all your retentions become from your bond. So to have the strongest bond to the restoration, you're going to want to have that porcelain. If it's a glass ceramic, you're going to want to have it etched with hydrofluoric acid and silinated. So you're treating that restoration. If it's zirconia and you're bonding zirconia, you're going to want to sandblast it. You're going to want to treat it with a ceramic primer after decontaminated. With zirconia, another point I'd make was it's real important when you try in zirconia, because zirconia has a great affinity for phosphate groups. And that's an important thing, because a lot of our new cements have phosphate groups in them. So it helps bond to zirconia, but so does saliva. So saliva will contaminate zirconia. So you have to decontaminate zirconia by using something like Ivoclean or Zirclean by Bisco, one of these products. Then you sandblast it, then you put your primer. So you're going to silinate glass ceramics, and you're going to prime zirconia or metal ceramics. So then you're going to treat the tooth when you're adhesively bonding. So you're going to have to do something to the tooth. You're either going to use a total etch technique, a self-etch technique. You're going to use universal adhesive or some type of adhesive on the tooth. So if you're going to use a total etch technique, you have to isolate. You got to put a rubber dam on. You got to make sure that if you're opening dental tubules, you're not going to get contamination or anything like that. All this is really important. So, and it makes the procedure more technique sensitive, and it makes the procedure more difficult to do, more steps are involved, and all of these things. So you would like to avoid all of that if you can, because it's just simpler and easier if you're just going to cement. So most dentists, myself included, would prefer to cement with a product like G-CEM ONE. And the reason for that is it's easier, it's faster, it's simpler, and there's less steps. So if you're not facing a situation where you need the extra bond strengths, or where you have a non-retentive situation, cementing is easier. It's faster, it's simpler. You don't treat the tooth. So with a product like G-CEM ONE, it's a resin cement, but it's a self-adhesive resin cement, meaning that you're going to get the chemistry in there will help bond to the tooth. There's some acidic monomers in there that actually help bond to the tooth. And there's also for example, the most common monomer that's being used now in a lot of adhesive dentistry we're using is called 10-MDP. I'm not about to try to say what MDP stands for because it's a really long word, but suffice it to say it's an acidic phosphate monomer. There's that phosphate again. It's acidic, which means it will help bond a tooth, because as you put this acidic chemistry on the tooth, it's actually demineralizing enamel and dentin and infiltrating, the cement's infiltrating all at the same time. So you're going to get some adhesion to the tooth. It's not going to be the same adhesion if you treated that tooth with adhesives, or the same adhesion to the restoration if you treated the tooth with primers, but there's some adhesion, and that's the beauty of a self-adhesive resin cement. You get all the advantages of resin cement without having to do anything to the tooth or the restoration. So it just makes it simpler and easier.
What's your take on regarding G-CEM ONE, the bond strength, and also how is the film thickness?
Okay, so there's a lot of things that make a cement. So we already said that if we something like a self-adhesive resin cement is simpler and easier to do because you don't have to do anything to the tooth of the restoration. But what you'd like is a restoration that, first off, the cement goes into the crown really easy, and the crown's easy to seat. So you want a film thickness, you want a consistency of the cement that allows you to seat the crown without undue pressure, without having to exert too much pressure, and the cement flows out easily, which G-CEM ONE does, which makes this really good from a handling properties. And you also want a thin film thickness so it doesn't interfere with the seat when you're seating the restoration. So, and that's another product, a property of G-CEM ONE that I like a lot. One other thing too, they've taken their really good self-adhesive resin cement and they've improved it a little bit, because if you run into a non-retentive situation, now you're going to have, let's say you have, let me back up and say, okay, let's say you've got a nice retentive situation. You just want to cement your crown. You can take G-CEM ONE and you can go ahead and just squirt it in the crown, put the crown on the tooth, clean off your cement, which we'll talk about in a minute about cleaning off, because that, to me, how easy is it to clean off is really important. But let's say you got a non-retentive situation. Now that means you got to have a different cement, you got to have adhesives, you got to have all this other thing, you got to have more product. Well, what GC did with their new cement, a G-CEM ONE, is they have primers with that. It comes with a little bottle, and so they have their adhesive that you can actually paint on the tooth, and it's compatible with the cement. So if you have a non-retentive situation and you need it to be a little bit more retentive, their adhesive enhancing primer is compatible with cement. You paint that on the tooth very simply, and you don't have to, you just evaporate the solvent and then put the crown right on the tooth, and it will bond. It enhances the bond to the tooth and to the restoration. So it will help you use the same cement in using it in a non-retentive situation, if you understand what I'm saying. So you have some advantages, and they also have another little bottle in there, their G multi primer, which you can treat the restoration with. So if you're wanting to increase your retention and you're not wanting to have to go to a totally different system, they've kind of taken this to another level, so to speak, where you have a totally what I call conventional cementation. To me, that is, you don't do anything to the tooth of the restoration, as opposed to adhesive resin cementation, where you have to treat the tooth and the restoration. It's kind of like a hybrid where you can do both with one product. Does that make sense what I'm saying?
It most certainly does. Now,
I hope I don't want to confuse people, because a lot of times you can kind of limit some of your product inventory. If you have one product that you could put a crown on very simple and easy by doing nothing to the tooth of the restoration, what I would call conventional cementation. But at the same time, if it was a little non-retentive, or you're worried that crown may not stay on and you wanted to enhance your bond strength, you can use the primers that come with the cement to enhance the bond. So it's kind of a neat system.
it really is. And I love the idea of minimizing your inventory. Now, speaking of which, I know when it comes to bonding a veneer or lithium disilicate crown, something that's a little bit see-through, if you will, we can tack cure that material and start our cleanup process. Can you comment on your cleanup process on a thin restoration like that? But also, this product has dual cure, self-cure capabilities, so that you can use it through a low translucency zirconia or even metal ceramics.
Yeah, that's a really good point. So, and it's a very good question too. So you have to understand, with thicker restorations or zirconia or even metal ceramics or something like that, light isn't going to be able to penetrate. But all self-adhesive resin cements are what we call dual cure. What that means is they have the ability to be polymerized with a curing light, but because the light may not penetrate the restoration, or it may be too thick for the light to penetrate, they also have self-cure chemistry. So that means, well, we talk about curing in the dark. That means that the cement, because it's dual cure, you're going to have usually a dual barrel syringe. So when the cements mix together, the self-cure chemistry in that cement is activated, just like in G-CEM ONE and all other products like this. It's a paste system, and they come with some of them. There are still a few products that you can triturate in a capsule, but most of them, are simplicity's sake, are in a dual barrel cartridge. And the assistant simply just squeezes the handle and expresses the cement right into the restoration. So the self-cure chemistry starts at that point. Now, that means that will set up, but you can enhance the bond strength, and you can enhance the polymerization with a light. So using a light in conjunction with self-cure, if the light will penetrate some, is beneficial. And most researchers will tell you that if you're using a dual cure cement, it's beneficial to light cure it as well, as not just the self-cure. Another thing I like about G-CEM ONE and products like this is when you put that crown on and you have them bite on a cotton roll, or you can hold finger pressure, they're very easy to clean the excess cement in a gel state. So that excess cement that extrudes out once you seat your restoration, we'll have them bite on a cotton roll or hold finger pressure, and I'll take the curing light and I'll go for like 1 second, 2 seconds, or 1001, 1002 on the facial and the lingual. Now you've converted that excess cement to a gel state. If it sets up really hard, or if you leave the light on too long, it's much more difficult to clean up, but it cleans up real easy. You can just take your Scalar Explorer and go right around the margin, and it peels right off. And that's what we do. And then we floss the contacts. But then we'd like the self-cure chemistry to work for a couple more minutes. So we have them bite back down on the cotton roll. We wait a couple of minutes, and then we come back and light cure at the end. Usually 20 to 40 seconds, facial, lingual, and occlusal. That's kind of like our process for using the self-cure and the light cure of a dual cure cement. You get I guess you could say, Pam, you get the best of both worlds that way. And it simplifies the cleanup process.
That's really interesting. And that's an interesting workflow that you just described. And I think that's really useful for our viewers, as trying to get the best of both worlds and actually use the products to their benefit the way they were intended. So thank you for that.
Yeah, I don't think, if the dentist cleans it off or the assistant cleans, I don't care who cleans it off, because chairside assistants can clean off the cement. I mean, they're qualified easily to do that. So, but my point is, if anybody's ever had to clean off a resin cement when it's set too hard, it is not fun to do. So it's much easier to clean off in the gel state, but being able to achieve that gel state rapidly can be really beneficial.
You mean
it makes cleanup so much easier. So handling properties, easy to extrude, easy to seat, easy to clean up, all of these, in addition to it works well in retentive and non-retentive situations, all of these are things that you like to see in your cement. And all of these things are a product like G-CEM ONE has.
That's incredible. So can you describe, say, maybe a really positive experience or, something that's kind of stood out to you during using the cement as you've been using it?
Well, I'd say, one of the best things would be, all right, let's say maybe this doesn't happen to me, recently, but let's say, have you ever had that situation where you put your cement, you go, well, this is good. This crown, it's a zirconia crown, posterior zirconia crown, and it should stay on. And for some reason, the patient comes back in and you thought it was retentive and you just went ahead, conventionally cemented it. You didn't treat the tooth. You didn't put any adhesive layer on the tooth, and you didn't do anything to the restoration other than rinsing and clean it. But for some reason, it debonds, or the patient comes back with the crown off. Well, in a case like that, rather than just doing the same thing again, what I would do, even if I'd put that on with G-CEM ONE, the next time I put it on, instead of doing it the same way, I would clean out the crown really good. If it was zirconia, I would sandblast it, and then I would put my primer that comes with the kit on there, and then I would put my enhancing primer on the tooth itself. So there's an adhesive enhancing primer that comes in a little bottle, and all you do is paint it on the tooth, evaporate the solvent. You don't have to cure anything, and then you just put your cement in the crown and put the crown on. Now that's going to enhance your bond, and they're going to work together. It's actually going to promote a better bond and a higher bond using that. So more than likely, you're going to have a better chance of that restoration staying on. So it's kind of like a little mini pearl for if in these debond situations, what do you do? And we run into that, limited occlusal distance on molars, especially second molars, where you don't have a lot of height, axial wall height. And so sometimes these are fairly non-retentive preps, and sometimes the crown will stay on and sometimes they don't. It just helps you in those clinical situations.
Well, that's awesome information. And I think that everybody will, without a doubt, benefit from that. And so if you've watched this video and you say, wow, I really need to learn more, which I know we all always need to learn more, visit.
You never stop learning, Pam. You know that as well as I do. If you know it all, if there's nothing left to learn, then there's something that's not right somewhere.
Definitely, especially when new innovations like this are, coming out
all the time.
Exactly.
Yeah. Cements are changing, and and I salute manufacturers, and I wouldn't want to end without at least adding that great companies like GC, there's so many great companies and manufacturers, their R&D departments are working overtime. GC had a great product. Okay, they had a great self-adhesive resin cement, and then they've gone and they said, you know what, maybe we can make it a little bit better. Okay, and we've got a great dual cure resin cement, like Link Force, and Link Ace, their self-adhesive resin cement was a really good self-adhesive resin cement. But now they said, you know what, we think we can make it a little better. And companies are doing that all the time. Manufacturers are doing that all the time. They are constantly looking for ways to improve and make their products even better. And that's a benefit to us, the dentists, and certainly I feel like to our patients as well.
I couldn't agree more. The better products we use, the better we look at the end game when our patients are happy with our outcomes. I could not agree more. So to get more information about G-CEM ONE, check out GC America's website, www.gcamerica.com. And Tom, thank you so much for your insights and your you gave so many great pearls for me and also for our viewers. So I really appreciate your time, and I look forward to hopefully seeing you again.
It would be my pleasure, Pam. And I've enjoyed talking with you today. Like I said, we learn just from talking to each other. That's a great thing about dentistry. You can just sit down with a colleague and just have a little discussion, and all of a sudden you're picking up a little mini pearl here and there, and the next thing you know, we're all better for it. So it's been my pleasure spending some time with you today.
The pleasure was mine. So for DentistryIQ.com, everyone, we will see you next time.